Greetings from a fishing village on the Atlantic coast. You've tuned in to podcast Portwenn, celebrating the world of Doc Martin unofficially. I'm Chesla and we'll be discussing Doc Martin, the medicine, the mayhem, and the marvelous people of Portwenn. Podcast Portwenn is an independent fan production, not affiliated with, endorsed by, or sponsored by Buffalo Pictures, ITV, Fox, or the creators of Doc Martin or Best Medicine. We welcome back Lisa Verney, our resident Portwenn retired psychotherapist. Viewers enjoyed Lisa's take on seasons 1 through 3, so today we'll focus on seasons 4 to 6. She's asked me to come up with some questions, so this episode is fraught with peril. Lisa, come through and welcome back to podcast Portwenn.
Thanks, Chesla. As always, I'm excited to talk with you. I was helped by the questions, and I thought there's a few main things I want to talk about. One of the main things is that during these seasons is when we see the baby, Martin and Louisa, become parents. They get married, they're living together. So their family life starts to get underway. And one of the questions you asked me was, why is Martin so miserable during these episodes? He's not lighthearted in any way. The only joke he makes is on their wedding night. They're fighting all the time. They're miscommunicating. It's just really pretty awful. And what just came into my mind was the idea that they're very crowded in the surgery, I think speaks also to just how crowded they are psychologically and how their issues, their unconscious issues and their traumas are really getting triggered. Now, you might not think about that right up front, but what I want to say is that invariably, I would see that people would start to have a lot of trouble after a baby was born in my practice. I think last time you interviewed me, I talked about how issues can arise when people make a commitment in their relationship, and then old things will start to come up. And I talked about it as like a playground for learning, even if it's not very playful. It's a way that people now have to face, what did they learn about relationally? What did they see? How are they treated? And if things aren't made conscious, then they're kind of stuck, right, in this defensive place, and maybe even repeating the way they were treated.
Okay. Oh, that could be grim for these two.
Right. And it is grim. It is.
I mean, when you think about Louisa's abandonment and, how shallow her mother is, I mean, we certainly learn that in seasons 4 through 6. And we learn a lot about Martin's treatment by his parents. I mean, just idle comments back and forth like, I was locked under the cupboard for hours at a time, or I was hit with a belt, or I cried myself to sleep as an infant and no one ever cuddled me, right?
And they're dropped in along the way. So unless you're really tuning into that, the audience may not quite be putting that together. On the show itself, they must have had a lot of consultants in the psychology field based on just what the diagnoses were of the patients and then their relationship. So one of the questions you asked me, well, you said you had your own theories as to why that he was so snarky, and you want to
why he kind of lost his, he sort of lost his sense of humor. Yeah, I mean, it felt like when you look at seasons 1 through 3, he was working up to something, right? I mean, there was the whole relationship with Louisa. He's wooing her in the only way he really knows how, right? He's being himself more, and when the wedding doesn't happen, I think it kind of breaks something in him a bit. And we don't really see what happens then, because when season 4 picks up, Edith Montgomery comes in, she's working on the paper, Louisa shows up pregnant without having communicated with him at all. It's been 6 months since she's been gone. It doesn't sound like they've been in touch. And, he learns that he's going to be a father. He's gone from sort of the person that he was presenting to Louisa to being now somebody who's feeling as if he just has to get out of the situation. She hasn't been there for 6 months. She was the only person who was keeping him there. So now he wants to go back to London. He just wants to resume his old life. You figure when he comes to town, he's pretty much the same person he was in London, except he's angry and he's got a chip on his shoulder for not being able to do surgery, but he's fundamentally who he is. And now he's got this broken part. And I'm sure that the townsfolk have really, really kind of run him down. He doesn't have the goal anymore. He just has this job of dealing with their health problems. So he's really been kind of ground down by them by this point. Louisa has treated him poorly in a way, just picking up and, I mean, they left as see you around, right? Like, it was friendly, amicable, and you don't know how long she was there before she left, but certainly before she was necessarily, showing signs of pregnancy. So it must have been pretty early, right? So I think he's just been ground down and he's ready to get out of there. And, he doesn't have the same goal anymore.
And then Edith comes around and he imagines a different life again at Imperial.
Yes.
And I know we want to talk about her too, but so what you just said, right? If I was working with them and they present it at this point, and you've just described what's happened and what's happening in their current life, and they seem very stuck. Again, I would say, in addition to what you've described that would account for this, what else might have gone on in their lives that might account for how stuck they are? So I put on my therapeutic listening ears and I think about how, if you think about in word processing, how you cut and paste something, some of the things you've said, I would say, let's cut and paste that and think, where does it fit in their life prior to this, and particularly when they were children?
Okay.
So Martin is devastated on some deep level, right? Feels like an utter failure. Yeah, we might not see that in his arrogance, but another way of looking at arrogance is to think that he's humiliated. He's turned against himself. And the idea of, where is this aggression? I know you and I have talked about this before. And he's depressed. You talk about how he becomes so depressed and psychosomatic even. And you think about, okay, what did he do when he was a child to cope with the abuse and the rejection, the disapproval? Like, what was his mental state back then? Underneath all the defenses, what would a child have been like? He wet the bed.
Right.
Right?
Very
He felt
insecure.
helpless no matter what he did. His
The only place you get a sense that he might feel comfortable was when he went to Phil and Jones.
And then he was removed from her.
Right.
So that utter helplessness as a child, that no matter what he could do, he didn't have control over the situation.
So playing off two things that you said,
Yes.
the humiliation, okay? The humiliation I see when Edith comes into his office and you can tell she's looking around it and she just thinks it's dim and ugly and what a step down he's taken. And you can tell that he's not comfortable having her there, and it does humiliate him. If he carried that into the village with him when he first arrived, it might have been hidden by the anger he had, which was more fresh at that moment. And now it's been some period of time. We don't really know. I mean, in TV time, it's 3 seasons, right? But it's more compressed than 3 years. And it's almost like she throws the gauntlet down to him that you can get back to that life that you had, where maybe there was less humiliation as an adult. But, when he first sees Louisa, it seems like the miscommunication starts immediately because they each make assumptions. She's already made a huge assumption in not calling him from London because she just assumes she knows what he's going to say about this.
Well, let's think about that, because you asked the question somewhere along the way about, she says, is this about me? Your depression. Is it me? Of course not. You don't sound like you're very sure I am. You don't sound so convincing. So
that was in season 6.
Right. But generally speaking, she's taking it all very personally along the way. Like what you just said about that she didn't assume that he would want to be involved. So think about that. Does that really fit Martin?
He's always trying to be involved, isn't he?
Not only that, but he is so devoted to medical things.
Mm-hmm.
So we see him become very, very, he can't help himself. I mean, the fact that he stays out of it as much as he does, and I know he doesn't, but it's pretty incredible. But what I'm saying is that her assumption that he would not be involved is based on her background, that her father wasn't involved, that her mother wasn't involved, right? There's a
Okay.
lot of, to go back to what I said about here they are, and they're coming from these templates, these relational templates, and they're really in the dark. They're finding their way through something and they don't have an example of it. And so they expect rejection.
Mm-hmm.
They expect criticism. They expect to be on their own. To go back to the humiliation piece, I think he's so humiliated because of Louisa. And then we find out too that Edith had rejected him.
True. Yeah, she just chose her career over him.
And so here's a guy who seems so utterly in control, or the need to be in control. He's rigid, he's obsessive in ways, but underneath that defense is a real fear and helplessness.
That makes sense. That particular quote that you gave, it just struck me when I saw it because he was like, she asks him, is it me? Very tentatively, like concerned. And he is vehement in his reply. Of course not. Like, so when she follows up with, like, you don't sound that sure, I remember watching it and thinking, he sounded incredibly sure to me. And then he's like, I am. I mean, vehement again. And she's like, that didn't sound that confident. We were looking at each other like,
Right. So you're like a lay therapist yourself, Chesla, because you have your background in hypnotherapy and you're tuning in. We call this listening with the third ear, right? So you hear that and it doesn't fit and it stands out like a relief map. It's like, this doesn't fit. And that's the clue. When something seems peculiar, like it doesn't fit, that
mhm,
is the telltale clue that it's about something old.
interesting.
And as a therapist, you start to hear this, at least, the way that I practice, you hear these things and they don't fit, right? Here you have this, like, in some ways, he couldn't be more loyal to Louisa.
True. He comes running all the time, even when she's saying, go away. You look at season 3 when Holly falls and Louisa had said, I don't want to see you again, Martin, right? But as soon as her friend falls, he is there, right? And he's going to make house calls to her. And it's for Holly. It's not for Louisa. It's for Holly. But when she's pregnant, he comes running every single time, right? She shifts furniture. She does this, every single thing. He is like, drops everything and runs. Are you all right? Are you all right?
So there's so much these days about trauma. Our culture here is just steeped with writing and talking about how trauma affects us. And one of the things where it really starts to show up is when people have children.
Hmm.
In order to be different than the way they were raised, they have to think about their pain. Remember last time I talked about you can't have empathy if you don't feel your own pain. So he
Mm-hmm.
locks Theo in the chicken coop. And he doesn't remember. It's not just remembering, like intellectually, I was locked up too. It's the
No, he locks Westmore up. Like, Aunt Joan locks Theo Wen up in the chicken coop. That's Aunt Joan.
yes.
But Martin, in the end of season 6, he locks the surgeon who's supposed to operate on Louisa in the closet.
Yes. And so you make a good point, though. I'm glad that you reminded me of this, because as you have been watching this, do you think about that Joan and Ruth were also raised by these parents?
Ruth, Christopher, and Joan were all raised by Henry Ellingham and whatever Henry's wife's name is. We never learned that. Right?
I think that what I'm thinking about is this generational trauma. Martin's father,
Right.
right? They were all raised by the same parents.
Yes.
And so this kind of abuse from Martin's father is pretty severe.
Yeah.
So again,
And we
we're
don't.
not talking about real life, but Joan locks Theo up. How were they raised? What did they see? I found myself thinking about this kind of stuff when I would think about, like with Ruth, how she was socially, and if they had children or didn't have children,
Mm-hmm.
because neither of them had children.
Right.
Joan.
It sounds like Joan would have liked to have, and Ruth never married. So
So to go back though to the punishment though, And what I'm saying about that, when people are raising children and, you hear people say something like, well, I turned out fine.
Mm-hmm.
And they repeat the same things because they have to feel what it felt like to be treated that way in order to then be consciously making a decision to do differently.
Mm-hmm. Yeah. Yeah, I can see how that would bring that back to memory. Like, I will not be, Martin even says, I'm not going to be my father and he's not going to be like me, right? So you think he figures that I'm not going to be like my father is causal to James not being like him, in the sense of his parents are what formed him. Therefore, if he's different, James will be different.
And he really wants to be different, right? At
Mm-hmm.
the end of these 3 seasons, we see how he's so committed to that. And he
Mm-hmm.
has so much to learn. And he needs Luisa's help. But you and I have had so many discussions about, well, so does Luisa needs
Yes.
help, right? You asked me as well about this comfort from the clock repair.
Mm-hmm.
Martin takes comfort from that. What do you think about that?
I think the fact that it's a solo activity that he's completely in control of is a good thing for him. And I think it is also like a surgical analogy, in
Mm,
the sense of, you have instruments and you have something that is constructed a particular way, but there's something wrong with it and you need to go fix it, and you need to be dexterous, and sometimes you need to, replace a part or repair a part in order for everything to work properly again. But it's almost meditative as well, because you have to be completely focused. Those parts are so small and it's a complicated mechanism. You can't be multitasking. You have to be completely in that moment and maybe not be worried about other things, or not be thinking about other things.
that's brilliant. I hadn't thought about it like that, as akin to surgery. And it makes me think too that that level of concentration, but the ease of it as the surgeon's doing it, that it is a kind of state
Hmm.
that you're in. Of course, I agree with everything you're saying. And I'm even thinking about how Martin would just disappear from the family and go and do that.
Hmm.
Again, if we think about the cut and paste, right? What did he do to get away from his family before he was sent off to boarding school? What did he do to get away from his family?
And maybe he had little hobbies like that where he would just go off and, they might not have been clock repair. He didn't have friends, right? So it's not like he went over to his buddy Joe's house or something.
So, one of the things that's really helpful to people I found in therapy is when, for example, suppose Martin and Louisa were my clients, right? And part of developing the empathy for each other is to explain this, say to Louisa, that it's not personal when Martin takes off, say, into his office and does the clock, but that this is how he coped as a child. This is how he survived,
Right.
was to go and do this. And once that information becomes conscious, there's so much more empathy. So for me, in addition to things we talked about, the symbolism of the clock is something I thought about. So here he is fixing the timepiece and repairing time. And so some of my associations to it were like trying to turn back time, or trying to correct time, put time in order, put a life in order. Some of
Hmm.
these things, like why the clock. So I had those associations to it.
Interesting. That
And
never occurred to me.
as we see that, if we think about what's going wrong, is that the past is interfering with the present. So becoming current, I often say to people that therapy is about becoming current, so that we're living in the present. And not only that, but we heal the deficits in our development, because people can be, 50 years old, but their developmental age and stage is not. They have to repair and receive things and develop things that they didn't have. So, if Martin's has a child, but some of him psychologically, developmentally is still 6, then how's he going to be a parent?
Yeah, it's interesting.
Well,
You've triggered some thinking in me. And, I wonder what the writers think about this conversation, because it's like, did
yes.
they have all this going on in their heads, like all this? But I look at this particular clock is his grandfather's clock. And his grandfather's someone who you get a sense he loved and respected more than he loved and respected his own father. And he has to fix that piece of the past and get that working. So it's almost a connection to the skip generation. But who comes along and steals it?
Right.
So his mother ends up, even after he's finally fixed it, his mother comes along and steals it. Like she stole so much from him as a kid. And who knows, like we might just be going off on a riff here that writers were never thinking of, but it's interesting how it plays out, right?
I thought of that too, that it was the grandfathers. By definition, trauma is not just something bad happening, but it's overloading and flooding the defense system, really without the aid of another human being to mitigate that. Or other things to mitigate it. So when people start to work through their trauma, say with the example I just gave you, Martin is no longer alone, right? He's remembering the trauma in relationship. So it's not just the remembering it, it's the going through it with a person. And that's why therapy is successful, because it is a corrective experience. The person's no longer alone. So it breaks through that.
One thing that I noticed that I thought was unusual and telling is because I thought about this clockmaking thing being a solo activity that's very focused. Right after they're married, he starts working on clocks again. But when Louisa comes in at one point, like, what are you doing? He tries to pull her into it. He actually, let me show you. To me, I thought that was growth in a sense of I had this solo thing and I have you now. And I would like to introduce you to this thing that I enjoy. And she walks off without a word. He doesn't even know she's gone because he's explaining something and he looks and she's gone.
And so this is what's so painful, right? When they make these little attempts, but they're so easily thwarted because there's such sensitivity and trauma. Like again, I'm not saying he was conscious of this, but he's making an attempt, right? He wants to try, but then it doesn't work.
Mm-hmm.
And it's not working because she doesn't really know how to do it either. She doesn't appreciate the meaning of it, that this is not a place where Martin's trying to disappear all the time, that he's trying to share it with her. And therefore they can progress that way. So it's very painful because like he's starting to try and she's starting to try, but because they don't have enough good experience yet, they can't weather the misattunement of that, right? So she doesn't understand that he's offering himself through that. He's not just trying to disappear. And then what happens is it's repeated. How he's been treated is repeated. She leaves. And so he might not try again. Because even, I don't know the timing, you would know better. Later on, that's sort of at the beginning, right? When they first are living together. But then later on, he's much more depressed and isolating. And she comes in with the tray, remember to have breakfast. And he doesn't really want to participate at all. He just wants her to kind of go away.
Right.
I think I said this when we did our other podcast. This is like a knot, right? Of all these different things where they didn't have enough of the good relational functioning and treatment. And they had all of this not good. So as they start to venture forth and they're so tender and so vulnerable, and then they are easily hurt, and it can get worse because it's reinforcing what their beliefs are.
Mm-hmm. Yeah.
And so to point that out, this kind of brings me, we can sort of switch it around a little bit to the village is a holding space, like a holding environment for their development. And I know we talked about this in the first podcast where you said, well, they can't stand him. He's a tosser. They want to get rid of him. But there's a way that the village is giving birth to this couple. And even the baby is the village's baby.
Especially how they portrayed it, right? With everybody listening in on it.
Yeah. Oh, right. That whole episode, that was amazing.
Yeah. Yeah, just the
That was
microphone. I mean, they
amazing.
actually put the microphone up to the phone so that everyone could hear all the stuff going on in the pub.
Right. And at this point, even though they are so critical, they're also so forgiving. But that's the ethos of the village, that
They're
they have to
very
tolerate.
invested in what goes on, right?
Yeah. And when I think it was at their wedding, when was it Penthouse says Luis is their uh, national treasure
Hmm.
for that. And the wedding reception is really for the village, and the
Right.
shower is really village. So I think that there's a rooting going on for them, even though at different points, right? There's, Ruth says you guys shouldn't be together. That would have been better for you if your parents hadn't been together. But everybody knows about it. Every single person knows their business. One of the things that I also I'm thinking a lot about Pauline right now, because my husband and I were disappointed when Pauline wasn't in the episodes any longer. We loved her. And you and I may have spoken about this before too, that she's like the observer, right? She's like a narrator almost through what's going on. And her delivery and the tone of her voice, we just loved that.
Yeah. She did a great job. I mean, I thought, was it Catherine Parkinson? She was very good. And I thought she was very good at running the office. But I was
Mm-hmm.
discussing with Pauline Johnson, one of my other guests. We both were turned off by some of what Pauline did because she steamed his mail open. She took the photos of him with the dog on that, hungover morning and then blasted him around the town. And even when he was leaving, she was kidding him that like I saw how you would just look at me and touch, and he's like, what are you talking about? She really pulled his chain.
I liked her because she was such a character, and she also
Yes.
gave it back. She gave it back to him.
Yes. Yes. Yeah, and I find that that's a recurring theme, that he gets along with the people in a sense who have a spine, who don't take offense at what he says and will give it back to him.
Right.
And I think he also appreciates that too, because Roger Fenn was one of my favorite characters, and Mark Milo, and both of them, you know, they wouldn't put up with Martin's nonsense.
Right.
They would yell back at him, and they would put Martin in his place. But Martin was resilient enough with those guys and with Pauline, and comfortable enough with them to survive their back and forth. Whereas I think the fact that he was besotted with Louisa, he wasn't, if she criticized him, he couldn't take it as easily. I
Mm-mm.
mean, that was a threat to what he was trying to establish with her.
Yeah, and he even started letting, like, Bert could come in anytime he wanted, practically, right? There were certain people who could barge in, and he'd let them come in versus saying you have to make the appointment. I wanted to talk about a few of the other characters. First, you mentioned about Edith, and you asked, did I think they were well matched?
Mm-hmm.
I do think they were well matched. However, if we go back to what is the fit here, and do we match up with people who are going to provide us with something we're missing? And also, he was very romantic with her, for Martin, right? He had written that poem. And so, in that respect, maybe not so well matched.
I didn't feel like she would help him grow. Like the two of them were these, intellectual, medical, studious, almost asexual people.
Yes.
They didn't drink, they didn't party. Like personality-wise, it seemed like they would go home and sit in their separate rooms or discuss medicine over dinner. I didn't see them do anything social. I didn't see them do fun hobbies together. They would be like cohabitating and comfortable with it because they're both okay being alone, even within potentially a relationship.
Right. And so, probably no friction either.
Although Martin didn't like her professionalism, and that probably would have bothered him. And certainly, we see how things play out. That, I mean, she books the room together, and he's just not interested.
And he's so honest.
Yeah.
Too.
But then when she comes back and it's like, I think you have a fear of intimacy, it's like, I just didn't want to be with you. And it's as simple as that.
So the lack of social skills, in a way, allows him to be so blunt in a way. He's unequivocal.
I don't think she believes him, though.
Right. What about that she's determined to help him with the blood phobia?
I thought her goal, I believe, was to get back together with him, to be a couple. And she wasn't going to live in Outer Mongolia, right? She was going to be back in London if she could get there, or at the very least in Truro, where she had her little clinic. And so she needed to get him to be, and also I think reputationally, she'd be embarrassed by this GP.
Yeah.
This fallen surgeon who's a GP. So therefore she had to get him back so that he could be the stellar person who he once was. Because you get a sense that she was attracted really to his prowess more than anything.
Which brings us over to Mrs. Tishel.
Love Mrs. Tishel.
Mrs. Tishel is my favorite.
Yeah.
We've talked about her. She is like the best actress.
Yeah.
She's so interesting, what they have going on with her. Every scene she's in, I am lighting up.
Yeah. Selena Cadell does a phenomenal job.
So, yeah, you asked me some questions about what about this diagnosis. I don't think I worked with anyone quite this extreme. And the elastic band, I thought that was kind of helpful, although it's also reinforcing in a way, right? When you put a behavior to something that's occurring, it just continues to occur.
In hypnotherapy, and we talk about anchoring a lot.
Yeah.
And, you use physical touch to anchor a particular sensation or feeling or state. And it struck me that, if she's thinking, I'm thinking about Martin romantically, snap. Is that a punishment in the sense that it actually hurts? Is it a negative thing? I wasn't sure if that was a real technique and how that all would work out.
Yeah. I mean, I didn't use those kinds of techniques, but I think it was effective for her in the show. And it kept her more grounded. It was a grounding technique. But yes, she really got rolling on this fantasy, and I think they did a really good job with it.
Yeah. Yeah. And I thought when she's, on the bus taking the baby, and she's just like, his father and I are very lucky. And it's just like, she's so into it. She is just completely in that experience.
You used the word prowess with Edith, and I think that there is something that is very enticing about men who have a kind of power. And he really takes charge, and that can go on to the mean side sometimes, or the arrogance, but in there is a reliable person who, again, is very esteemed. And we see the contrast, how she is with her husband, right? She can't stand him. Yeah.
I'm not sure she can't. I mean, she certainly can't stand Clive, who can't hear.
Right.
I mean,
well, he's a nuisance to her.
He's a nuisance to her, especially with her crush on Martin.
Right.
And that, the difference that she sees, like, she might have been completely happy with Clive at one point in her life, right? But he's the safety officer on the rigs, which I presume is some level of high responsibility to make sure that everything goes okay. So, he's got those, a skill set. That's an important one. That's a critical one. But this medical professional comes to town who's far different from Dr. Sim, you get the sense. And I think I was talking to Rob about it, and Martin is the most educated guy in the village at this point, and most sophisticated because he's from London, so he's posh. So she just, once she sees Clive compared to Martin,
that's
and
a really
he's being so annoying because he's screaming at her because he can't hear. She's just.
And you're right. Just his presence is interfering with her fantasy. She has to pay attention to something else, and even the privacy of what she's doing upstairs in the cabinet. But she has this fantasy that she's going to go to London, and yeah.
And when he's gone, it's easy to imagine she's not married.
Yes.
But when he shows up again, it's like, oh yeah, I am Mrs. Tishel.
Right. I also wanted to talk about Ruth and Al, because I just love their relationship.
You just took the words right out of my brain. I mean, she, Al grows up so much in the show. You know, you get hints of it right off the bat. In the first episode, isn't he like, he's quoting Du Maurier? Like in the very first episode, and it's like, so this is a guy who reads, he plays chess, like he really does develop, and Ruth clearly sees something in him.
Yes, I think I talked about this the last time too, that there's this development going on of all the characters, right? So Bert and Al continue to grow into more individuated people. Bert starts to have relationships and Al does, and Al's not living there and the businesses. And Ruth gets to have this relationship with him too, where she didn't have any children. She gets to, I know she'd mentored a lot of people, but she gets to have this dynamic going on. It's really lovely.
It is. I really liked seeing the two, and the fact that she's willing to invest in him and support him, and also give him what for when he needs it. I mean, he's moaning about how his life is, and she's like, take charge, and you're the one who needs to do something about it. It's not like it's going to happen on its own.
And she develops because when she first comes to, I'm not sure again the chronology of it, but I think it's at the wedding that she says that she can either be very awkward or overshare. She's much more awkward when she arrives in
Yeah,
the
at Joan's
village.
funeral. Yeah,
John's
I'm
funeral, right?
awkward or I overshare.
And so she becomes, again, better, sort of, more, a greater range of relational functioning. We know more about her background as time goes on. So I go back again to the village has this quality of nurturing the people in it.
Yeah, yeah. You're right, because you never really think to yourself, Ruth is somehow growing too,
Mm-hmm.
right? When she's out at the farm, it doesn't sit well with her after a while. Certainly when she has the whole experience with the stalker,
Mm-hmm.
and she understands how incredibly isolated she is out there, and comes to town, the village is now right on her doorstep, so she has to interact with these quirky neighbors. I think it's Mr. Moisey is her neighbor, and doesn't even want to talk to her.
But even she, when she's babysitting James and all the men come through to help her, and there really starts to be this community going on. But they're struggling. Martin and Louisa are struggling at
Yeah,
this point,
I really feel like
which is
they struggle. I mean, you've got the season of the pregnancy, and then the season of cohabitation, which goes terribly. The season 5, at the end of it, it's like Martin's leaving. This is not working for them, right? Because doesn't Louisa move to wherever her mother is staying? And, it's clearly not working. And then the end of 5 is when they have Mrs. Tischel summarizing the entire series in about 30 words, which that's still my favorite scene in the whole show.
what's that?
When Martin's talking to the, deranged
Yes.
Mrs. Tischel. And I also love this. He's got a psychiatrist, and he's got the woman he loves, and he's got this crazy lady who has his son. And who does he trust?
Right.
Whose advice does he take, right? He takes Louisa's. And, Martin trusts the doctors, right? He trusts his aunt. Like, everything would lead you to believe that he would be listening to whatever Ruth told him to do. But he doesn't.
Except his heart, he's trusting his heart. And what comes into my mind just then is Joan, right? Joan had much more heart for Martin. So if we think about, again, the cut and paste, why might that be that he can attach to Louisa or rely on her, trust her? They're similar. Louisa and Joan are similar in that way, that they're more heart people.
They're definitely more heart people. When I think back sometimes on Auntie Joan, I start thinking of some of her stridentness.
Yes.
And it sort of taints a little bit of that warm and fuzzy, soft, teddy bearish kind of curly gray-haired lady with the sort of frumpy clothes from the farm.
Yeah, I mean, I think that culturally and the time, the age she is and the background she's from and what Martin needs, but she really steps in to help Louisa and is ready to be that grandma figure.
Yes, absolutely. And yet she locks Theo Wen in a chicken coop. Well, not to say he didn't deserve it.
Right.
I mean, he didn't
Right.
deserve it, but boy, he was a piece of work.
He did kind of deserve it, but yeah, there was no alternative. What's her name? Margaret.
Yeah, Margaret, yeah.
What was the dynamic between her and her husband? Right. And who was really the meanie? And so many times, Chesla, I worked with people where there was abuse, and the abuser literally was the father, but the mother was the instigator of it.
Hmm. Intentionally?
Sometimes, like, allowing the father to take the mother's aggression out on the children,
Oh, wow.
punishment, abuse. Um,
So the mother would keep her hands clean, per se, but she was the one who had the anger and wanted to do some sort of level of discipline that the father would then do.
yes,
Well,
and
you
keeping
certainly
score.
learn. Wow. You learn
Go ahead.
in whatever it's season 2, because Mark Milo's still in it. You learn, the whole sad story of Christopher and Margaret were thoroughly happy until Martin came along. And then Christopher wanted nothing to do with Margaret after that. And the resentment that she had that she directed at Martin. Of course, that's his whole life. So you don't know anything about Christopher other than he's a womanizer, right? And a slimy character. But was he likely to smack a kid with a bat if he hadn't had Margaret there?
I mean, I had, horrible, horrible, stories of this.
Mm.
And then it's so difficult because the child is trying to figure out, the child who's an adult in my office, considered the mother the safe one. But then you go back a little bit, it's much more insidious than that. Look how sneaky and conniving and manipulative Margaret is.
Mm-hmm.
And also often, most of the time, if the father is working back then and the mother's there, then the child's with the mother all the time. So again, these more insidious things and who's who, who's doing the wrong thing. A child can't make sense of that. So a lot of times they'll feel like it's them anyway. So it's very, very confusing. And this teasing out of who's wrong, who's done the wrong thing.
You do hear who hit him, and that was his father, but I don't know if we know who locked him in the cupboard. We do know that his mother didn't comfort him when he was an infant crying.
And also, I don't know if you've heard people talk about this with abuse, where people might say, I'd rather have been hit,
Mm-hmm.
because hit is a validation of something that was done versus this psychic manipulation and this verbal stuff is again so insidious, and it's hard to say, well, I was abused.
Yeah. Yeah. Yeah, because he was cut off from love.
Yeah. So just think about when Louisa is disappointed or critical, that makes a cut in him that must remind him again unconsciously. This would be someone, if he came into my office, where he would be very, very guarded, and I'd have to go very carefully because the appearance of being so together in control would make one think that he could handle a lot, where really he would be easily wounded and then cut off. You said this early on, and when we talked the first time, when he would say things like to Louisa about the bad breath or whatever, because he's uncomfortable. Once he's starting to wade into that relational intimacy, he can't handle it. It makes him
Mm-hmm.
anxious. Well, of course it makes him anxious.
Yeah.
It's
He didn't
unsafe.
have good experiences with it growing up, or any real experience with it. And he'd default to his medicine because that's what
Mm-hmm.
he knew.
So, some of the other great things in this I'm thinking about with medicine too, and medicine is the way he can take care of people. That's acceptable to him. That's safe for him. He doesn't have to get involved with them, but he can take care of them. And he really,
It's his
like you
love
say,
language.
it is. It is. I'm thinking about when that midwife comes, but I also, as much as he tried to insert himself prior to that, he was incredibly tolerant. but what was he going to do but to be so shut out? And then
Yeah,
finally Louisa relents,
I just found that talking to Judy, she was saying how he treats Louisa's pregnancy like an affliction.
Yeah.
And he wants her to quit work fewer hours. He doesn't want her to be a full-time teacher. I couldn't believe when he told the Board of Governors guy, have to be a special woman to be a single mom and have a full-time job. And Louisa's not that. I mean, that was a horrible thing to say, and I'm not even sure he believed it. I think it's just he wanted her not to be the headmistress, and he was trying to torpedo her.
Right. So why though? See, again, this goes back to when, as a therapist, is like, what is that about? It's charged, right? When something is charged, it's like, well, what does that mean to him?
And is it because he wants a mother to be home with his baby because he didn't have his mother home with him? But I mean, he had his mother home with him, and it was horrible. He doesn't want her to work.
Well, that's why sometimes it's very confusing what time period they're in, because it's this village and it's away from a metropolitan and it's a different culture. It's hard to know, like, is this current? Is this old? Because it's very old fashioned. He's very old fashioned.
Yeah. But with her, I mean, he doesn't obsess over anybody else's pregnancy, it doesn't seem, but it's his love of his life and his baby.
Maybe
And
also that he's afraid something's going to happen to her.
could be. I mean, she certainly runs herself into the ground and gets anemic, and but that was like, really? Come on.
That bugs you.
It really does, because it doesn't seem to fit with how he really thinks about her. I think he believes she's very competent. I don't think he would be drawn to anybody that he didn't find to be intelligent and competent. Although he is drawn to her beauty, really, more than anything, right? The attraction that we see, well defined, is how beautiful he finds her.
Yeah. Well, you asked something about the blood phobia in here.
Yeah, he sort of seems to clear it up in season 4, and then in season 5, he's doing okay, and he's going to head to London. He seems to have it under control. And then in season 6, when he's starting to get depressed, you see a progression of sensitivity to the blood, because it's like he does a blood draw, and he starts to fade. And then he gets put off by Ruth's steak. And then before you know it, he does end up vomiting on Joe's shoes. So it goes from its littlest form to its biggest form, while he's also becoming more and more depressed, and he's losing sleep, and he can't eat, and he's testing his heart, he's testing his blood pressure, he's sending out urine for testing. And then even when Louisa leaves, he's convinced he's got a physical problem, and he goes and talks to Ruth about it, right? And that's such a touching scene when he's talking to Ruth. And she's like, why do you think this is a physical problem? This is not a physical problem.
Well, since it's all together with those other symptoms, then it's likely related to it. At the end of season 6, when he operates on Louisa.
Yeah, so when he goes to operate on her, he seems comfortable with the surgery. I mean, he's kicked out the other surgeon. He feels like he's the only guy who can do this successfully. And he even says, I don't need help with the surgery. I've done this 7 times before. And that's when he talks about how he needs help being a husband. But he makes the incision. He's got the catheter in, and then he looks at his fingers, and it's got blood. And he gets the nurse to hold the catheter, and he has to go on it. But he can come back and finish.
Yeah, I think that, so there's got to be some connection to the blood phobia and all these other attachment issues. And if it's coming and going, I would be watching as a therapist for when it's coming up, but how else he's doing in every other way. What's it connected to?
Yeah, and he's certainly depressed. Do you think that season 6, he is getting depressed?
Yeah, he's in the throes of it.
Yeah. When he makes a joke at the wedding, it's the first time we've seen a joke in a bit, because the last joke I remembered was season 3. So here we are in season 6, and he makes another joke. That's a long time. And I'm thinking he's feeling comfortable again, like he's starting to get into his stride. And then after that, everything starts to just go off the rails. And I think he doesn't know how to be a father. He can't take, like you said, the surgery's too small, although he says that's not a problem. But, like it's noisy, it's squeaky. And I think Louisa has expectations of him, like play with this baby, and he doesn't know how to play with a baby.
And also, people are moving his stuff around. I think he's probably depressed all the way through these 3 seasons. I mean,
You
he
think
might
it
have
starts?
moments where, well, I think there's moments where he's feeling more joy, but his again, we have to say his baseline, even when he was successful in London as a surgeon, these old things were still in there. So he might have felt better, but at some point they were likely going to come up when he got more involved relationally.
Yeah. And in 4, what he thought would bring him joy of being married to this woman, that's done. So I could.
One of the things we always talk about in therapy when people present for therapy is what's the precipitating event? So these questions you're asking, like why now or what's going on, it can be just a tipping point, but it's important. Like, what does it mean? And why now? And then also how I liken what's happening with Martin and Louisa is when people come into session, even if people are running in to start therapy, by definition, it's going to stir up a lot of these anxieties because it's a pretty intimate relational space to be having a person know you. And so the way that I worked is if I didn't pay attention to that anxiety, people might not still stay in therapy. If I wasn't just a cognitive behavioral person just looking at the symptom, we're looking at the symptom in the context of a relational space and how people feel judged or supported, or all that stuff is going to come up. So I'd be on the lookout. Like one of the first things I would do when people would come in the first sessions, I'd ask them how they would feel about being here. And then as I'm going through it, I'd ask them how they're feeling about what they're talking about or how I'm responding. I immediately set the stage for, we're going to talk about how you feel right in the room, and that's okay. And you can tell me what you don't like, what you don't feel comfortable with, or what you are liking. Because
So
go ahead.
you've given them the permission to give you feedback on how the sessions are going, so they don't feel like it's just going to be all one-sided on how you want to do it, but like how they feel about the therapy right off the bat.
Right. Because if you think about, say, with Martin, I could be the most supportive therapist, but it's going to increase his anxiety to be this close. And he's going to scan threat. And when people do that, what does Martin do if he feels that way? He goes into retreat, into withdrawal, into his own place. So he would be somebody who wouldn't come back. We call it early resistances, like what's going to get in the way of the therapy. He would think I'm an idiot because I'm not.
He would think you're the idiot.
He would think I'm an idiot, right? Because that's his main way of doing things. He's dismissive. So I would right away have to call that out and think about with him what's going on when he's doing that. And my calling him out, like you say, how other people in the village do that, would earn his respect. He would know that I wasn't going to take it, that I was strong enough.
Right. And that kind of does come through with his sessions with his one session with Dr. Milligan, right? Because right off the bat, he's judging Dr. Milligan to look too young and too informal without a suit on. And, he's not giving very full answers to his questions. It's like, how does it make you feel? Well, I'm a surgeon. It's inconvenient. He's not really participating, even though he got this from Edith. He decided to do it. He proactively made the appointment without being nagged. Yet you just know he thinks this is BS and doesn't really feel like it's going to help. And I thought it was interesting when Dr. Milligan says, you're not running away from me, you're running away from yourself. And yet he does get the CD with the desensitization stuff, and he does try to follow through, and it appears to work.
And it matters to him. Losing that phobia matters to him. So he would be somebody who probably wouldn't come to therapy until this point in time where he's going to lose his wife and child.
Nothing else has worked, really. I mean, he goes to Dr. Milligan in season 4, which is before he's really regained Louisa and before the baby is born.
We often say that people will not present for therapy if they're not in pain. So they can have a behavior or a symptom that isn't causing any distress. They're not, we call it's a term egosyntonic versus ego-dystonic, that there has to be some level of conflict going on that the person themselves is bothered. Like you said, he wasn't bothered that the village people didn't like him. He's not coming to therapy to think about that.
Right. Yeah. Yeah. I mean, he goes to the therapy that Edith recommends because he wants to get back to London and be a surgeon. He wants to get out of town and succeed in that because there's nothing left for him in Portwenn.
You make me remember, though, why I liked not that I've forgotten, but why I liked my work so much, because it's a puzzle. And if I always likened my job, I love doing jigsaw puzzles. So you think about that, you get this frame. I do jigsaw puzzles. I make the frame of the puzzle first. And you kind of get the outline of what a person's story is, what their struggle is, what their life story is, but you don't understand it. And you see them in life and you hear things and you start to put, clusters of pieces together like you would. And after doing it for so long, you can start to imagine what the story is. I had this great professor who taught us how, if we look at the present as this picture, right, of what's happening, and you start to think, well, where did this come from? This way that a person is came from somewhere. And then you can kind of backtrack, like I just, what I've done here with you some, and imagine, well, this is the way they had to be. And when people see that that's the way they had to be, and then they can say, well, I don't have to be that way anymore because I'm not in that circumstance anymore. And that's when you start to make the shift. It's not just knowing it isn't going to make people change. They have to then go out and practice. They have to practice, like Martin has to practice not withdrawing.
Yeah. And Louisa especially has to practice not withdrawing. That's like that's her game plan when something happens, right? It's just, I'm leaving.
Yeah. So anyway.
Yeah, this was fun. It's always good to see you.
You too.
I appreciate you being on the old podcast, and I hope our viewers have appreciated it, and hope they will do the old like and subscribe on things. And, we do plan to come back again. At some point next year, we can take season 7, I think.
Right.
And then if we still have energy left in us, we'll finish out with 8 through 10.
Okay.
Are you going to watch Best Medicine?
Yes. Do you know when it premieres?
Definitely the 6th of January, possibly the 4th. But
Wow.
I think no matter what, they're going to have it on the 6th. But there's talk that they might have it after the 2 football games on Fox, sort of as a, to me, that's a special launch. When you're doing that after your football games, you're trying to keep that football crowd and show something that you like. And I've seen the extended trailer now, which gives me a better view. The first one seemed to be far more like comedic stuff. And the new one is a little longer, and it shows that he has a problem with blood. And you get more of the, okay, this will be a dramedy and not a comedy, which puts my head in a better place. Like, I'm very much going into this with the intention to like this show. And I'm trying to sort of expunge the gold standard show from my mind and go in and say, okay, this is a brand new show. Let me just see what the premise is. Let me see how the writing and the acting and the filming are, everything that you'd look for in a good show. And we'll see how it all goes. My plan is to start doing an episode per week on Best Medicine after they start airing, to just talk about it and maybe at some point say, okay, at this point we're going to do a little comparison.
Okay. All right.
Maybe we can have a watch party.
Yeah, that would be fun.
So thanks so much for joining me.
You're welcome.
Everybody, if you like it online, give us a comment, subscribe to the feed. Thanks again. Have a great holiday. Take care. Podcast Portwenn is an independent fan production, not affiliated with, endorsed by, or sponsored by Buffalo Pictures, ITV, Fox, or the creators of Doc Martin or Best Medicine.